series. I'm glad to see you all here today. Everybody's got a seat. Oops. Oh, Edith's hanging. Hey. What are you doing, Edith?
If I don't hand them out, I'll eat them all.
There's treats for everybody else later, but these are just hanging. So welcome to the Empowered Senior Speaker Series for June 2026. Of course. So for those of you who don't know me, how many people are here for the first time today? Several. Welcome. Glad to have you. My name is Marian Gord. I'm the host of this event. We've been going since June of 2023. I am actually, this is not my full-time job. I'm actually, sometimes it seems like it, but I'm a real estate broker, and I work primarily with older adults, later in life moves, and estate sales. And it's through my experiences in working with these clients that I've realized, and being in this industry, that there's a lack of information and a lack of availability, and there's a lack of consistency. There's a lack of having everything in one spot. So the series was put together to hopefully address those gaps in information and to bring that to you in a, we'll just wait.
Sorry.
We've got a lot on the go. What are we doing?
Can't see in the video. All done.
Okay, thank you. Thanks, Lisa. So the information that is presented at these sessions is current, it's reliable, and it's presented by competent, compassionate service providers. So it's a great resource of information here, and I just congratulate you for coming today to take advantage of this opportunity. I just wanted to acknowledge that these sessions are put on with the support of our educational partners. They are here every month. They are all senior service providers offering a variety of services. Among us all, we've covered the gamut of things that you might need in the future, either today or at a future point in time. And I'll just give them a couple of minutes to introduce themselves, please.
Hi everyone, I'm Carrie Atma with Estate Solutions with Care, and I do anything related to estates, so estate planning, NPOAs, professional executor, power of attorney for personal care and property. I do document organization, daily money management, so a slew of services around that area. If you have any questions, please come see me.
Good afternoon, everyone. I'm Judy Rickey, and I'm the owner of Clutter Relief Services. And our professional organizing team specializes in seniors, helping seniors and their families with downsizing, clearing estates, and just general decluttering. So let me know if you need any help.
Good afternoon, everyone. I'm Adrienne from Chartwell Retirement Residence, and I'm here with my colleague, Nicole Hood from Chartwell Martha's Landing. And we're excited this month, which is June, Seniors Month, to partner with the City of Burlington for some really incredible events. I encourage you to join us for the Silver Screamers documentary event at Burloak Cineplex, which is next week on June 18th. And there's also going to be a wonderful seniors lunch and dance on June 25th at LaSalle Pavilion. We look forward to celebrating.
Hello, everybody. My name is Meredith. I am a hearing instrument specialist with Hearing Well Matters, just up around the corner on Maple Crossing Boulevard there. We deal with everything to do with your ears and your hearing, so whether that's wax removal, existing hearing aids, new hearing devices, baseline hearing tests, anything to do with your ears, we are happy to help you.
Good afternoon, everyone. My name is Kim Rutledge, and I am the sales and marketing for Vistamere Retirement Residence in South Oakville. We're just over at Third Line and Rebecca. We are a small community feel retirement with 94 suites ranging from studios to 2 bedrooms. And our calendar of events is welcome to anybody who would like to be participating. You don't have to be a resident living with us to be participating. So we've got lots of activities to share with you. If you're interested, come and see me. Thank you.
Hi, I'm Sarah Sunix. I'm a funeral director with Smith's Funeral Home. My specialty is planning ahead, so making sure things are talked about, discussed, planned well. And I also help with aftercare, which is applying for Canada Pension death benefits, executor checklists like what to do your taxes, what to do with a passport, what to do with your vehicle, all those questions that no one knows the answers to. Just a little personal note, as of July 4th, I will have been with Smiths for 9 years, so it's a pretty good number. Yeah, thanks.
Hi everyone, welcome today. My name is Sarah Nastimagu. I am a registered nurse with Vida, and we are going through a new branding change because we were formerly known as Bayshore Healthcare. So with Vida, we are offering more services. We have clinical leaders that are in place and in charge of your care plans. So the first person that you'll be introduced to is a lifestyle advisor when you call to set up what it is like, what you would like to set up for services, and the next person hopefully you see would be myself. And with the healthcare services, it will be a registered nurse that's in charge, and we staff PSWs and our RPNs and RNs that will come to your home and oversee and supervise. I have my colleague here, Diana, and we are in charge of GTA West between here and Burlington. Or from Burlington, sorry, to Mississauga, where I'm located. I hope you all have a great day.
Hello and welcome. My name is Kelly Stern. I'm here with one of my colleagues, Pam. You may have seen Pam and Jennifer here the last several months. Together we are compassionate care collaborators. We are end-of-life doulas, so anything to do with death, end of life, we're there for you, whether it be planning ahead, dealing with a terminal diagnosis today. We've also served as maid companions. We'll be doing a talk on maid in the fall, so if you're interested in that topic and learning more, please come in October. Well, come to all the sessions, but especially. Anyways, we have some information brochures up here if you're curious to know what else we offer.
Good afternoon, everyone. My name is Jeanette Bogg, and I'm an elder care planner. So what that means is I help seniors and their families to transition from their home where they may have grown out of into, and I mean that anyways, we'll talk about that. And then I also help people to think about what their plan is. Where are they going to go? If they leave their home, what's next after that? And so there needs to be more planning ahead these days, especially given our healthcare system and the way that it is. You need to have an idea of, when I'm not living home anymore, where am I going to live? Am I going to go to a retirement home? Am I going to downsize from my 4-bedroom home to an apartment, a condo? What am I going to do? So I help answer all of those questions, and I also am there in a crisis, a healthcare crisis situation as well. I'll help you navigate through that. That's it for me.
Thank you, everyone. We also have Dr. Sandra Belfry. I'll be introducing her later, so we'll just wait for that. And also, there are a few other educational partners who are not here today. So we all are working with the senior population, and I'm sure you can appreciate that sometimes crisis happens, and the ones that aren't here are dealing with crises. So our goal is, all of us, I'm going to say, speak on behalf of all of us, is to avoid a crisis and not put yourself in positions where you're having to deal with something in an emergency situation and not being able to make the best decisions possible. So all of us have different expertise. If any of the services of any of us would be happy to help, but also if the service that you need is not represented here, somebody here will know where to go to turn to be able to help you. So once again, thanks to all the educational partners. For everyone's contact information is on the handout, including the ones that aren't here. So once again, thank you. Thanks also would be remiss if I didn't thank Lisa and Ida. They're my backroom gals and to help us to get organized. So thanks again for being here today to help us out. So I mentioned if you were here last last month is saying the Empowered Senior Speaker Series is growing. We are now in our 37th month. When we started, we had 65 people, and the most we've had here is about 190. So we've set up today, the room only has so much capacity. I was looking at other venues, and doesn't seem to be anything that's more suitable than this location. Potential that we'll go to 2 sessions on the same day, a morning and an afternoon session, to be able to help accommodate the need of the community, and also to just be able to provide the session to more people. If that happens, I'm not making any promises, but if that happens, it won't happen until September. But what's really important then is that we communicate with each other. So I am sending out monthly emails, and if you're not getting my emails, please call me, or please somehow let me know, because I need to know that someone is on the other side. So, because when you're registered, but actually for this month I had to turn off the registrations because we were approaching the capacity of the room. So I don't want to be turning people away when we have empty seats in the room. So it would really be important, and I would appreciate if you could just acknowledge the emails, and if you're not getting my emails, please do let me know. Make sure that we can connect. So this is also Seniors Month, and so congratulations to you all. Who here is a senior? That would be me. And the theme this month is Let's Get Moving. So actually, even when I started this series, one of my goals was to help with target seniors isolation, because we started this just after COVID was easing, and so it was a safe place to come and get seniors out. And I know that many of you have made friends over the course of our sessions, and I hope that that continues. So I'm happy to be doing this for the community, and also just acknowledging the seniors and the valuable contributions that every one of you is making to our community and to your families and to your personal lives. So congratulations on Seniors Month. In doing some research about Seniors Month, I came across on the Ontario website, they have actually a seniors guide, which is quite comprehensive. So there's a QR code here. If you wanted to pull out your phones and take a picture of that code, it will lead you to this guide, which you can then, which was downloadable. I will send out the link to that as well in our follow-up emails, but I was surprised to see how much information was included there. It is, as I said, quite comprehensive. And having gone through this journey, I've also been asked many times over about services that are available in our community for seniors that we don't know about. So I've committed to starting a resource of a list of those types of services. So not the stuff that everybody's paying for, but what's available in the community. So a couple of things come to mind. There's Friday Night Community at Wellington Church. Someone here was telling about bridge clubs. There's lots of different services. So I appreciate if you could help me create that. And on your evaluation forms today, if you know of something, if you could write that down so that I can log that and include it in a resource. It's going to take some time to create this, but it's a goal that I have, and I think it will be beneficial for all. And so we're celebrating our 3rd birthday. So again, thank you to everyone who's been coming religiously since the beginning, and to all our new people. We hope that you're here for 3 more years, and we're committed to being here for you if people still keep coming. So congratulations to everyone. Very quickly, I'm sorry to have all these announcements at the beginning. Just a bit of housekeeping. So as you know, you've got some notepads on your chairs. Please do take notes of anything, any questions that you have that come up during the presentation. We will have a Q&A at the end. Makes it a little bit more fulsome conversation. Parking, I know that that's a little bit of a pain point for everybody, but we are on the honor system here. We're asked to pay $5 per day per car. So if you haven't paid when you came in, please do pay on your way out. Just ask that you turn your phones off or to silent so we have as few disruptions as possible. And I just want to make sure everybody at the back can hear. We're good? Perfect. Thank you. Okay, so here we are today. So as mentioned, when I started this series, it was really to help beat social isolation, and just by being here, you're helping to do that for yourselves. So it's not a coincidence that we have this topic today in June in Seniors Month. So I'd just like to introduce to you Dr. Sandra Belfry, who is also one of our educational partners. She is a clinical neuropsychologist and art therapist with 25 years experience providing mental health treatment and dementia diagnoses for the adults and seniors. She helps people overcome mood and anxiety symptoms, care partner burden, improve sleep, manage chronic pain, and compensate for cognitive changes. She focuses on helping people to improve their quality of life and coping skills. Her research has touched on factors associated with sexual health, care partner burden, and dementia. Dr. Belfry recently launched MenoLink, Connecting the Dots, an interactive workshop service that provides education for all ages of adults about women's reproductive health, menopause, and dementia prevention. The program connects health research findings in a relatable way so that people can understand how women's brain health is shaped by experiences and biological transitions unique to women, such as puberty, pregnancy, postpartum, perimenopause, menopause, and later life aging. In private practice at Lifespan Psychological and Neuropsychological Services, Dr. Belfry is the clinical director of the Healthy Aging and Dementia Clinic and the Women's Menopause and Brain Health Clinic, where she received referrals from physicians, neurologists, and the public for mental health and cognitive health assessment, diagnosis, and treatment. And in order to give back to the community, she provides many public lectures and sits on many volunteer boards, including the Alzheimer's Society, Elder Abuse Prevention Ontario Halton, and the Canadian Psychological Association. So we are in good hands with Dr. Sandra Belfry. She's a busy lady. She's been up to the last couple of days, and she's got more on the go, so we're fortunate to have you presenting for us today.
Well, thanks for having me here, everyone, and I'm really impressed with how many people who showed up today, so thank you for coming. I'm going to be talking about social isolation, loneliness, and how these factors can impact our cognition. But I will start by telling you a little bit about myself. And so I am your friendly neighborhood psychologist. I work in Burlington. You can come see me in person or virtually or by phone. I'm very flexible. I've had the Healthy Aging and Dementia Clinic here for 15 years. Prior to that, I worked at Baycrest Hospital where I did my internship training and then my postdoctoral fellowship there. Okay, so, can we, yes, just gonna back up. Okay, so I gave out 4 color cards, which you'll need sometimes 2 of them, the pink and green for yes and no, and then sometimes you'll need all 4. And when you see this icon come on the screen, there'll be a question. And so this is also a bit of physical activity where we're going to lift our arm with the color card answer. Okay? Now you're not required to answer. If you don't want to answer, that's fine with me. Some of the questions are my personal interest. Some of the questions are skill testing. Okay, so here we go. First question. I know what a neuropsychologist does. So we have pink is no, green is yes. Okay, it's a good mix, but mostly no's, which is common. So that's why I asked this question. And so I always now provide a slide. And also when I have a referral, a lot of my patients that come, I say, oh, do you know why you're here and do you know what I do? It's no and no. So we have a lot to talk about. So a neuropsychologist specializes in cognitive brain health. So that's dementias, neurodegenerative conditions, as well as neurodevelopmental conditions like autism. And we also diagnose mood disorders. So it can be any type of mood disorder, anxiety, depression, bipolar disorder. And so as a neuropsychologist, so I'm both a clinical neuropsychologist and a clinical psychologist. A clinical psychologist just diagnoses and treats mood disorders. The neuropsychologist does the mood disorders plus the brain injury or neurodegenerative or neurodevelopmental. And so another thing that a neuropsychologist does is cognitive testing, so that's how we might arrive at a diagnosis. And then we also do cognitive rehabilitation, and so that's training and strategies to compensate for changes in memory, attention, executive function, language. We also do behavior change consultations. I have a lot of patients who are care partners for someone with dementia, and there might be something that we call a responsive behavior, which are challenging behaviors in the home. An example would be having difficulty with getting someone into the shower. And what are the things that we could do to help? It might be playing some relaxing music. It might be the way that we are approaching the shower time, what language we're using, or eliminating language, because sometimes that gets confusing. So we consult with people and with organizations about those things. We also direct community health teams, so if somebody has a PSW, maybe an occupational therapist, physiotherapist going in their home, we might oversee that team to let them know the best way to communicate with someone with a dementia or with a serious mood disorder. The other areas that I focus on are sleep problems and chronic pain, and sexual health. And so I will talk a bit as we go throughout to give you a bit more information about that. But one of the things that's really important for cognition is sleep, so I hope to touch on that a little bit too. Fancy transition. I was messing around last night. But then I said to you, yeah, that's why I was up late. I was, oh, this is fun. Okay. So this is my clinic, and then this is Menolink, a new business that I've started. I call it my side hustle. And it's mainly virtual workshops. There will be some in person, but they're meant to be intergenerational, so all ages of people coming to learn about the things we were never told about women's reproductive health and what it means for our aging brains and preventing dementia. There's a lot of new things out there about this, and the research is really transitioning, and we're going to have a lot of more new and better information in the next few years. And also one of the other things I'm working on from an advocacy perspective is I'm trying to help seniors in Ontario better access mental health and cognitive health assessments and treatments. And so that's something I'm doing by myself at the moment through the Ontario Psychological Association, but we're hoping to start a steering committee so that we can help better connect people to our services. And so in addition to it being Seniors Month, it is also World Elder Abuse Awareness Day on June 15th. And I am on the board for EAPO and the EAPN, which is the Halton. So I just wanted to take a minute to talk about elder abuse because it relates to social isolation. People who are abused tend to be isolated and not get out. So as I'm giving this talk today, I'm hoping you'll be thinking about people in your community that you might be concerned about, because we're going to talk a bit about how to help others be more social in addition to helping ourselves. And so elder abuse is a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust, which causes harm or distress to an older person. And so just so you know, in terms of the law, if you know of someone being abused in a regulated health facility, like a long-term care facility or retirement home, if you tell a regulated health professional, they're required by law to report it. So please do tell a regulated health professional, and they can make a report. In terms of the community, though, we don't have that law. So there are no formal laws about people living in the community right now, and it's a huge topic of debate. I have commented on a number of government social policy initiatives in this area, but unfortunately, there are a lot of ethical considerations in making that change, so right now, that's where the laws stand. I'm not going to get into all the different kinds of abuse because I believe you've addressed some of those in other talks of financial scams and frauds. But if anyone has any questions after, please come see me. And also, you can go to the Elder Abuse Prevention Ontario website, which is here, as well as you can call them if you have a question about elder abuse, and they will get you to the right place. And then here's some other resources for you. Okay, so we were on the same webpage. June is Seniors Month, and also as a part of the website for the government, I saw something interesting. You can nominate a senior this month for an achievement award, and I think there's a number of people in this room who could be nominated. So if somebody might do that, that would be great. And so these are some of the resources that you can find, and Marion mentioned that and has the QR code, but it is a great resource for sure. Okay, we're going to do something fun now, and so you may find throughout this presentation we're going to have some little breaks just to keep it interesting. We're going to do a little get to know each other, and so from the second row, I'm going to have the people sitting in this row introduce themselves to the person behind them, and so on. For the first row, if I could have the sponsors come and introduce themselves. So what we're going to do is each person is going to introduce themselves to the other person in their dyad. It could be a group of 3 as well if necessary, and or 4, but it's really better to keep it 3 or 2. So we're going to learn a strategy to support memory called spaced repetition. Has anybody heard of spaced repetition? No. Okay, good. Then we'll learn something new. So this is a neuropsychology rehabilitation technique, a compensatory strategy for memory. So spaced repetition is repeating information you want to remember, where you initially repeat the information out loud, and then in your head over short intervals, and then in long intervals. And if you look on the top right, there's a schedule for how you're going to say the name. So say you're introducing, or George introduces himself to you, and you say back, "Hi George, nice to meet you." So now you've said it out loud. And then as George is talking, you're going to repeat George in your head at 15 seconds, 30 seconds, and try to work George into the conversation. So, George, tell me about what you did yesterday. So this is a way of encoding information over time. And then I'm going to be cueing you to call this name up 1 minute later, 2 minutes later, 5 minutes later. Maybe Marion, you can help me with the timing. And then later on today. And we'll see if you go out knowing the person's name. Okay. There are names right here. Put your names down. Okay, so if I could bring some of the sponsors to match up with the front row. And I don't know if the couple at the table, if you want to slide into 2 chairs or not, but if you're okay watching too, it doesn't matter. Not everyone has to participate, so let people know if you don't want to participate.
So you guys just started.
We're at our 5-minute cue, so repeat the name. Repeat the name in your head now. We're at 5 minutes. All right, so that is an example. It was a loud example, and I apologize. Of how you can learn someone's name when you're out at a new social group. Or you can use that for tidbits of information as short facts as well. Okay. Oh, here we go. It's question and answer time. On average, how many social activities, clubs, or programs do you attend per week? So, pink is 1, green is 2, yellow is 3, and blue is 4 or more. So we have a very active group here.
Is that you?
Okay, so I just wanted to explain the difference between social isolation and loneliness. They're actually 2 separate concepts. So social isolation is a lack or reduced quantity of meaningful communication or contact with others, where loneliness is more of a subjective feeling state when our relationships are lacking. Okay? So on the bottom here, what is the value of a community approach? It really is important for all of us of any age to be reaching out to isolated older adults in the community, and I'll get to the reasons why, but basically social isolation impacts your cognition and puts you at greater risk for developing dementia. So it's really important from a mood perspective as well as a cognitive perspective to reach out to people. And I know Penny was in charge of Seniors Without Walls for some time, which, is that still going?
No.
Okay.
You read this screen because this was provided by Third Age Learning.
Really?
Like also
Okay, yeah. So Penny's group, Third Age Learning, also provided the screen in this building for this presentation, but there was an organization called Seniors Without Walls where they would call isolated seniors and provide contact. It was a really great program. Okay, so also throughout my slides, I have resources. So this is another resource online, and it's the Canadian Coalition for Seniors Mental Health, and they have a number of really great resources about social isolation in general, but also mental health. And so one of the things that this guide talks about here is if you're feeling lonely, and maybe you're worried that you're depressed or down, write out some of your feelings and symptoms before you go to the doctor so that you've got an idea of what you want to say. And so if you do have these feelings, you can go see your family physician, but you can also go see a psychologist, or there are also psychotherapists and community counselors. So the difference between a psychologist and a psychotherapist is a psychologist has about 10 years of education to 12 years, 3,000 hours of clinical training, and they can provide a diagnosis. A psychotherapist goes to school for 4 years, sometimes 5, and has 500 hours of training, maybe in a clinical setting, and they cannot diagnose. So there's quite a substantial difference, so it would all depend on what you're looking for. Also, psychologists are required to train by age group. So I am actually licensed to work with seniors. Psychotherapists have no such training or designation. So we'll get into the cognitive implications. Okay, who here worries about getting dementia? Yeah, I think we all worry about it. It's very common. In the last 4 years, I started a women's menopause and brain health clinic at my practice because I'm actually receiving a lot of referrals from neurologists sending me middle-aged women and asking the question, do they have dementia due to menopause brain fog? And so no, there is not a causal relationship between brain fog and dementia, but I do see a lot of women with that question. So let's just define dementia. What is it? So it is an umbrella term for a number of conditions. There are many types of dementia. So Alzheimer's disease being the most well-known type of dementia. Other types of dementia include vascular dementia, Lewy body dementia, frontal temporal dementia, and underneath frontal temporal dementia, we have several other kinds of dementia. So for example, primary progressive aphasia is a type of frontal temporal dementia. It involves a language loss before memory. And so each of these conditions have a different profile when I give tests. So sometimes I can see the profile clearly, and other times it's not entirely clear, or it might be mixed. Like a lot of people, so 20 years ago, I would see a lot of Alzheimer's disease or vascular dementia or multi-system atrophy, or there's all kinds of different diagnoses, but in the last kind of 6-7 years, I rarely see someone with just one type. And it's always vascular, there's always a vascular overlay, and so that vascular risk factors for dementia are high blood pressure, high cholesterol, type 2 diabetes, thyroid problems, sleep apnea. So there's also a new risk factor identified for women. It is if you've had a medical menopause where you had a bilateral oophorectomy, so both ovaries removed at the same time as having a hysterectomy, and you did not receive hormone treatment at that time up to age 51, that is also a risk factor for dementia. So the reason why I started Menolink is that today's senior women did not get a fair treatment for menopause. It was not thorough. In fact, it was most often wrong, or nothing was done, it was neglectful. And so that leaves women with a number of conditions that are untreated. But I'm not going to focus on those today, but if anyone wants to talk to me about that later, I'm happy to talk about it. I will a little bit, because I can't help myself. Okay. This is the Lancet study. I don't know if anyone's familiar with the Lancet Commission. They update this study every few years and talk about the modifiable risk factors for dementia. So these do change over time. So this is where we're at, and they already missed the biggest one, which is sleep is not on there. It will be on the next commission. So what this means, first of all, when I say dementia can be prevented, I mean some dementias, not all. So some people are born with some risk factors and biomarkers for dementia. But really the most causal relationship in terms of can we predict who's going to get dementia is really only for people who have a parent with early onset dementia. So that has to happen between the age of 35 and 65. And it's a much rarer condition. Everyone else, the dementias are preventable if we control for our cardiovascular risk factors, our reproductive health risk factors, and then some of these items. So what it means here is that roughly 4 to 5% of dementia cases are estimated to be attributed to social isolation. So that they're in late life. You can see the 3 main factors that you need to worry about in terms of dementia risk if you do not have dementia or cognitive impairment right now. It's pollution, vision loss, and social isolation. And then in midlife, for anyone who's here in middle age, these are the factors you should be focusing on: excessive alcohol, obesity, hypertension, smoking, diabetes, physical inactivity, traumatic brain injury, depression, high LDL cholesterol, particularly women in the menopause transition, it goes way up. You should get it checked. And hearing loss. It's a big one for dementia. And I'm surprised it doesn't make it down for having a higher causal, but this is just So none of these are meant to be on their own. The way that they do the percentages is in combination with each other, all these factors. So that's why it kind of presents like this. So the best predictor of not getting dementia is in early age, having excellent education, going on in education, also being bilingual or trilingual can help delay dementia by 5 to 10 years. So we want to create neuroplasticity, and so my Mental-like workshops, that's why I want young people to come as well as all ages, so that we can learn about the things we need to do when we're younger, in middle age, and in old age to protect our brains. Okay, so I'm only going to talk about one study. Oh, I was thinking we were out of time. So we're at 15 minutes. Repeat the name in your head of the person you met. Got it? If you don't know the name, go back and ask the person. Next, I want to talk about, I'm only going to talk about one study because I find presenting research studies to be not the most exciting thing to present. And so, but there's a lot of studies about this topic of being social, and they've actually quantified now, which is the amazing thing. We used to say, yeah, we think socialization prevents dementia, but we don't know why. Now we can say, well, we don't know the exact mechanism, but we do know the exact amount of delay of dementia. So this study was called Late Life Social Activity and Subsequent Risk of Dementia and Mild Cognitive Impairment. I guess I should tell you what mild cognitive impairment is before we go on. So mild cognitive impairment can be a diagnosis you get before you get dementia. So someone could have a stroke and still be independent in a lot of ways, but have some challenges with memory or language. They would meet the criteria for mild cognitive impairment. But you can meet the criteria for mild cognitive impairment from having some medical conditions as well, other types of things. Like sleep apnea. And I've actually diagnosed dementia for someone who had only sleep apnea, but that's very rare too. So, mild cognitive impairment doesn't mean you will get dementia. It means you might. So when we diagnose someone with mild cognitive impairment, we can say, these are the things you need to do to prevent. So maybe this happens when you're 65. If you control your high blood pressure, your high cholesterol, I might have missed that one, and all the other factors I mentioned, then you have a chance of not going into dementia. So that makes it important to actually get some testing. And this is where we have a real problem with our healthcare system and where we're at today is if you want to have a cognitive assessment about dementia, it's a 2-year wait at St. Joe's in Hamilton for a free assessment, and they might not give you one when you get there. They might just make a presumptive diagnosis. If you go to your family's physician, they will give you a screening test called the MOCA. I'm sure you've all heard of it because Trump announces the answers all the time. He's very proud of himself with that test. It's a screening test though, and it's not diagnostic. And so the problem that's happening that no one seems to know about is we're diagnosing dementia based on a screening tool. That's not how medicine works. And so, unfortunately, this is an ageist approach to healthcare. And so one of the things I'm working on with Elder Abuse Prevention Ontario is this human rights initiative that older adults actually deserve full and thorough healthcare, not the cheapest version. So I do offer these assessments privately, but it's very expensive and it's really unfair that that's the way it is. But if you need one urgently, I get people in 4 weeks. So that's kind of the nature of where we're at. And to be clear about why I'm in private practice, Bob Ray decided in the 90s to kick all the psychologists out of the hospitals, so we didn't have any jobs. So that's why we're in private practice, not because private practice is more lucrative, and I can assure you it isn't. Okay, so the facts about this actual research are amazing. So for those who are less socially active, the mean age of dementia onset, 87.7 years. Well, that's pretty late. So I was surprised by that. But the 5-year gap is tremendous. And I'll tell you, I see a lot of 87-year-olds and up at my practice who call themselves and ask to come in and do mood treatment, or we talk about family dynamic problems, making decisions that are difficult with adult children. I might bring the whole family in if there's a topic that we all need to talk about. Just so you know, I've always worked with seniors, and my oldest patient has been 99 for mood treatment and bettering their interpersonal relationships. Yes? Oh, mild cognitive impairment is MCI. And so for social activity was associated with a 21% lower risk of developing MCI, mild cognitive impairment, and so a 3-year difference in onset for MCI. So that's really fascinating that we can pull these numbers, and so I'm looking forward to more research in this area. This study is 2025, so very new. Okay, another question. Oh, we need to join. Thank you. Yeah, thank you, Mary. Okay, so which option is not a type of dementia? And I did make this hard. Oh, maybe not. It's not hard. You guys are educated. Look at you, it's delirium. Yay! So, I will give my little spiel on delirium. I'm actually starting a research study in the fall, and it will be focused on preventing delirium in senior women, actually, by addressing the prevention of UTI. Just so you know, you can get a home UTI screening test. If you use a catheter, it's not good, it won't work, but this is for men and women, can take an at-home UTI test. Buy it at Shoppers. You can buy it from this company, Utiva, they'll ship it to your house. So, delirium is a sudden onset state of confusion that doesn't last. It's caused by an infection in your body. So it used to be for women, the #1 cause of delirium was pneumonia, but 2 months ago, UTI usurped pneumonia and is now the #1 cause of delirium in the world for women. So just in my little soapbox about that, what might cause UTI more frequently in senior women? GSM, another acronym. Genitourinary symptoms of menopause. What that is not nice, but it's atrophy of the tissue in the vaginal area, and it makes you more susceptible to UTI. And because today's senior women didn't get treatment for GSM like today's middle-aged women are getting, your atrophy and tissue damage is much more severe and much more likely to cause a UTI. So if you want to talk more about that, you can come to my workshop or come ask me. But it's a very important issue because one episode of delirium can give you permanent dementia. One episode can. Also, in your life, an episode of depression, a good reason to get your depression treated is one episode of depression can put you at further risk for dementia as well. So we're getting a lot more savvy about mental health and cognitive health in society, but people still don't know where to go or what to do about it, and so that's my role. Okay, so to reduce dementia risk, let's start with being socially active is the point of the presentation. So I'm going to actually, in some future slides, have some suggestions, but this is just basically listing. But I like combine social interactions with other activities. So for example, a walking group, talk and walk, those kinds of combinations, or if you go to the RBG, some kind of gardening group or hike or bird watching, that combines the physical with the talking. Challenge your brain. So we're gonna get into something fun again here. So pursue lifelong and novel learning. Everybody asks me, so I'm okay because I'm playing brain games on my computer. Although those are a little bit helpful, they're not actually the most recommended. The research says if you want to expand your neuroplasticity and engage your brain, you need to do something you enjoy, number one, because you're more likely to do it. And you need to do something novel. That means something that's new. So if you're playing Sudoku over and over and over again, it becomes rote. So then you're not learning, you're just repeating a pattern. So you want to try learning a language, learn an instrument, go to a talk like this one, like you're all doing, about something you don't know about, because you have to encode the information and focus on it. Okay? Playing games with people. So you can do bridge with people in person, you can do, I know my mother does bridge online with her friends since COVID. There's lots of ways. Use reminders. So a lot of my older adult patients would say, I'm not going to use cues or reminders because I need to use my brain or I'll lose it. And so what we say is actually it's, if you have a problem and you are forgetting or you find you're missing things due to attention, then use a list and use cues, because better function reduces stress. Mm-hmm. Stress, if you allow your stress to go through the roof, then you won't be able to pay attention and then you won't be able to remember. Attention is the first process we need to have happen before we even get things into memory. So if you make an attention mistake, it's not that you're forgetting something, it's that it never went in. And so that's how when I test people, I look at the various processes of memory, encoding, storage, and retrieval, so that I can see at what stage in the process something's going wrong. And so, for example, in Alzheimer's disease, what I would see is a storage problem. They got information in, and then when I asked them about it later, they couldn't get it. Some people can't get the information in. That's not necessarily Alzheimer's disease. So that's associated with other things. Other people get the information in, they store it over time, but when I ask them to recognize it, so I show them what it was, and they say, oh, I'm not sure, that's a different problem altogether in retrieval, and has more to do with depression and slow thinking processes, where we know we heard it, but we don't really know where. Also menopause brain fog. It's another one. So, okay, attend cultural activities and cross-train your brain. So we're going to do something fun. I might need you to hold this for me. So cross-training your brain means do things that lateralize movement across your brain. So say you're left-handed, do stuff with your right hand. If you write with your left hand, try writing with your right hand. Try eating with your right hand. So we're going to do an exercise to, I'm just going to get a piece of paper. So everybody loosen up. This is a quiet exercise. Pardon? Is this a quiet exercise? It is a quiet exercise. Okay. So we're going to do right hand on our left ear. Okay? And then we're going to do our left hand crosses over onto our nose. And I'm sorry you all have papers there. So now this is challenging, but basically when I say switch, you're going to move the hand from your ear to your nose and your other hand to your other ear and switch. and switch. And so that he is across the arms. Can you do it? It's
Oh my gosh.
I practiced all morning.
Totally.
So I'm awesome now.
You cheated on the
I
test.
cheated. Thank you, Miriam.
Oh, that's great.
So try that one at home. And there's a program called Brainable. I could dig it. I think it's out of Baycrest where they do more things like that. But I also include them in my workshops. Can you do it? No. I couldn't do it the first time I was shown it. And then there's harder ones that I really. But again, it's so we want to lateralize the brain. That means use both sides. Okay. Oh, and just so you know, the information is. Oh, it's time to repeat the name in your head. Got it. We're just full of surprises today. Lots of things we're keeping tabs on. Okay, so this information in the next few slides comes from an Alzheimer Canada article that they wrote. So some of it's my own stuff mixed in with it. Okay, so manage chronic stress. I love, everybody says, you should manage your stress. I bet you go to your doctor and they say manage your stress. And you say, great, but how? They never tell you how. My workshops tell you how, or if you come see me in person, I'll tell you how. This is what I do for a living all day long. I spend an hour with people and we work on strategies for anxiety, for depression, as well as sleep. Back to that, I have a specialized treatment protocol for sleep. It's called CBT-I. The I stands for insomnia. And it's a very specific approach to helping people with insomnia. It does not work for sleep apnea because that's a different problem. So, when you notice, how do you notice your stress? You might be getting headaches. You might notice you're agitated, pacing, like I tend to do when I'm talking. So yeah, a little bit of stress. A little bit of stress is good. We always need that for a little bit of drive. But too much stress, and then we release cortisol into our bloodstream. And releasing cortisol on a regular basis into our bloodstream does two things we don't want. One is it impairs our immune system, so that we're more susceptible to colds and flus. And it impairs our memory. So when you're releasing cortisol, you're less likely to remember things. And the reason why is it's part of our fight or flight system response. And so when you have a trauma, like you run into a bear on the street, you don't want to remember that. So we release cortisol so that we don't remember as much about trauma. It's a protective factor. So that we just don't want to be releasing that regularly. So if you find you're stressed, anxious, or you don't know, or if you're socially isolated, call a psychologist or a counselor, or go talk to your family physician. If you have insomnia, you should also talk to your family physician and get a sleep study, and advocate for yourself on that. Demand a sleep study. They are now doing them. My mother-in-law was able to pay an extra $200 to do it from home. So I don't know how many places are doing that, but they're doing a remote assessment. So, because nobody likes going to that, I haven't gone yet, but I need to. And yeah, no one wants to go to a clinic and have someone watch you sleep. So it's better at home. Okay. mysleepwell.ca. So I met the person who started this website. He's actually a PhD pharmacist and his wife, and they've created all these sleeping tools to support your sleep health. And if you want to see me, I can help you go through them, because some are easier than others in terms of, there's calculations, there's some math involved in terms of our sleep stimulus control and our sleep drive. So these factors are what I work on with people for sleep. Stimulus control means how much time you stay in bed. Your sleep drive is when you need to be asleep or awake. Relaxation strategies for sleep and visualizations. Working on thoughts, rumination that keeps us awake. And then sleep hygiene, which is about keeping the room cold, having the same bedtime habits. So sleep relates to social isolation because if we don't sleep well, we're less likely to go out to a program, so sleep becomes very important. It's also important for preventing dementia, as I mentioned. Okay. Be physically active. I'm sure everybody knows this one by now, but we're now talking about green time, which is green time instead of screen time. Go outside, and for everyone in this room, I know that's been your life, and the screen time's probably a bigger problem for the younger generations, but if you've ever had anything like a concussion or things like that, the things that our brain wants to feel better is to see organic shapes like leaves, trees, water. So the more you do that and look at those things, the better it is for your brain. Wear a helmet, protect your brain. Go to the doctor regularly, manage the vascular risk factors like I talked about, and try to prevent delirium. So talk about this with your doctor, and I will let you know when I'm doing the research study for people who might want to participate. We're going to be doing an art therapy education module to help people understand how to prevent delirium. Okay, hold up your card. I'm currently worried about an older adult who I think is socially isolated. So a mix in the room, so that's more than I thought. Okay, so people are concerned about others in the community. So let's talk about one, social connections. Before we get to helping people in the community, I just wanted to give you some resources of where to look for social events other than what Marion already mentioned, but also what should social connections look like. They should have structure, they should have function, and they should have quality. So those are the components of a good social interaction. So this information is from Connection in Action, which is a Halton-based resource. So they list various organizations that offer services like Acclaim Health, Links to Care, Distress Center Halton, faith-based organizations. HMC is the Halton Multicultural Center Connections, library. The Senior Center in Burlington has always been really great. Sometimes I do some free talks there. I haven't lately, but probably we're getting back to that. But they have really good educational programs, so I highly recommend looking at those. And so these things are more, what we all know and what all of you are already doing. You coming here, joining clubs, joining groups. But improving technology skills is something that you could work on to improve neuroplasticity. Go learn how to use something like Instagram, or go learn how to use an Excel sheet or something like that. Join a language conversation circle, and this is helping people who are newer to Canada is also a nice way to engage in social activity. So you'd be helping other people learn the language, you might learn a little bit about their language and help people feel more assimilated. So there's also join a walking tour, attend an exhibit tour, go on a trip, tours, and you keep these for the website, those presentations, people need to find these.
I will send it there.
Yeah, okay. Yeah. Okay. Who is at risk for social isolation? Oh, it messed up. So we have pink is a person with no car, G, care partners, or green. Yellow is people without internet, And B is all of the above, or blue is all of the above. Yeah. A care is the new term for caregivers. So care partners, so we don't call people who are caring for a spouse or a parent with dementia, they're not called caregivers anymore, they're called care partners, to be more inclusive. Great, so yes, that is blue, all of the above. Okay, so people with dementia are at risk, people who are depressed or have severe anxiety, people with Parkinson's disease or mobility changes, chronic pain, poor sleep, people with vision or hearing loss, or both at the same time, a recent loss of their spouse. This is very common. You might see somebody retreat to their home when they're trying to work through grief, and an important time to reach out to people around us. Care partners, and some barriers that create social isolation are like a lack of transportation, financial limitations, language limitations, or not having access to the internet. So these are the people we should be looking out for as a community. And so what the main research hubs in older adults are trying to encourage is a community approach to helping others. So I have a scenario. Your neighbor's spouse passed away 6 months ago. Since that time, you have not seen them at your regular social group or church, nor have they been out of their house very often. They look like they may have lost weight, struggling with keeping up with household tasks like taking out the garbage, the mail, paper, or keeping up with the lawn. Okay, so what would we do in this case? Does anybody want to call out a suggestion? Go ahead.
Visit them.
Visit them, yes. Great idea. Yeah.
Phone them.
Phone them, yes. Great. Great. So when we get to the point of talking to them, then it's important to be thoughtful of the words you use and the way you ask questions. So would they like support, and if they do, what kind? Offer to be a social companion or a friend. Assist with tasks if you can, or help find some assistance for tasks. Offer to drive people to appointments. I know that the closer communities and often church groups, this is really well established, but for people who aren't part of those communities, they might not have this. Also, the Red Cross offers volunteer drivers to medical appointments for a minimal fee. So that's something that could be suggested to someone if they tell you they can't get to their medical appointments. The Red Cross in Burlington does do that. Check in with a visit, phone call, do a grocery run or make a meal, introduce them to new people or a club that you're part of. And then empower people who are new immigrants or have language barriers to be a part of community and various groups that you're a part of. And be creative in the ways that you do that. So, how do we start a conversation? Just relating to yourself and your experience is a good way to break the ice. So instead of saying you need to have your lawn cut, it's more, we're having trouble keeping up with the lawn. Are you having that experience? That kind of thing. So turn your words around to be more questions and open-ended, not direct statements or criticisms. So we want to stay away from criticisms. And also, people worry if they go to help a neighbor, maybe I'm overstepping. And so it's always best to ask so that you're not overstepping. And then words to use, best offer support that is specific. So, and that if you're gonna offer something, make sure it's something you could follow through with. Otherwise, be honest, I don't know how to help you with that, but maybe we can look together to find a resource as opposed to, I'm gonna do it and then you're stressed because you don't know how to do it. Ask an older adult if they are socially isolated, and so that can be upsetting and lead to further isolation. Try using terms instead of isolation, like engagement, connection, well-being. Okay. Okay. What is a good strategy for improving social connections? Pink, join a club. Green, connect with a neighbor. Yellow, volunteer. Blue, all of the above. You guys are getting really good at this. Maybe I made the questions too easy. I'm really upset about the delirium thing. I thought I had you. Oh. Now I have to come up with better questions. So, okay. So we have time for questions, and it's time, right? Yep. And we do say the name in your head again. I'm not sure we're out of time, but yeah. Okay. So I have a QR code for my website. If you want to take a look, you can sign up for a workshop if you're interested. And in the fall, I'm trying to get an in-person one to offer here or somewhere else. Yeah.
Thank you so much for your presentation. You mentioned earlier that if you had a hysterectomy in midlife, but what about if you have a hysterectomy in your 70s, for example? Is there anything different?
There isn't a relationship unless it's with the oophorectomy, that it has to be both. And also, so the relationship is about the lack of hormone treatment. So that's where the concern lies. And so typically you'd be finished hormone treatment by 70, so the concerns wouldn't be the same. Yeah.
I have 2 questions.
Okay.
Dementia, can that happen at any age group because it's like brain conditions?
Yeah, so people with Down syndrome have a much earlier dementia before age 50, but typically, there's been a few cases, like very few, of before age 35, but the early onset dementias happen around 35 to 65, and in those would be Alzheimer's disease, rarely Lewy body disease as an early onset, and then primary progressive aphasia tends to have an earlier onset.
And the other one is, I'm always interested in the brain and our capacities.
Yeah.
And why one person can remember so much more than another. But just life itself, you have to remember a lot of things.
Yes.
So have they done any studies on what's our capacities to remember anything?
Well, I can't speak to that specifically, but what I can tell you is everybody's different. And so, you know, we're all born with certain intellectual abilities, and some of these are crystallized abilities. So that's our intellect and our knowledge of facts and our visual basic knowledge and some other things, natural abilities to solve problems. And then we have fluid skills. Our fluid skills are memory, attention, the speed that we think, and language. And those things can change with age. Your crystallized skills never change. So even if you get dementia, you still hold your IQ, so to speak. Even though you might not be able to convey it to others, that still remains. And so in terms of memory, some people do have much better memories than other people. It's a continuum. And some people have specific types of skills for memory encoding that comes naturally to them. Like someone might tell you, I have a photographic memory, that is a real phenomenon. And some people can remember things in whole images. And so those people do tend to have higher accomplishments in life because the ability to retain information is above other people. But there's also some people who've trained themselves in memory strategies. I don't know if you've ever heard them they've been on the radio and TV, where they actively try to remember like thousands of information people call in and keep giving more. And it's because they're using a mnemonic strategy to do it, which is attaching a song or an image to the thing they're trying to remember. And I didn't get into that strategy today, but they can then add on to thousands of items. So you can train yourself. But as for the research, I can't, to the top of my head, I can't come up with it, but I'm sure I've read it. One more and then, yeah.
This is not so much a question, but a little bit of a line. But I've noticed since COVID, the amount of appointments and things like that that are going to Zoom, it's all over the place. I have psychologists who I can't see in person anymore. And I find if you were talking about social connection or social isolation, for me, any Zoom experience is always more isolating or less connecting than an in-person experience. And I'm even just thinking right now about, I've really enjoyed your presentation, but if I was watching it later, you know, over whatever, I don't think it would be as good.
Yeah.
And so it's in the medical profession now that there's more and more Zooming happening, and yet I feel that's creating less connection, at least as far as I'm concerned. I don't know if you have a comment on that.
Yeah, no, I think a lot of people say that. The one, I guess the pro and the reason for the push is to get access for people in rural situations who might not have access to local medical professionals. But that being said, it's harder to pick up on social cues by Zoom, body language and things like that. So there are for sure limitations, and so, you know, we recommend a mix. The College of Psychologists actually recommends to us, I don't know that they enforce it, but we're not supposed to offer virtual only at this point. We're supposed to give patients a choice. But I know that's not being followed because a lot of people have branched out to virtual only, and I do suspect that rule will change with health tech and the push for, I mean, their AI is doing therapy now. It's not even a person, and people like it. So, yeah, they've done studies in bariatric medical departments, and that's where it's had the most success, where people actually don't feel judged, so they prefer the AI bot over a real person. I'm gonna go to Penny first, because she had her hand up.
Penny. I have a question. I had a hysterectomy in my 50s, and I was put on hormone replacement therapy, and that has come to bite me behind. Because it's been proven that 20 years down the road, people who have no history in the family of breast cancer, myself being one, now are dealing with this.
Yeah, they gave the wrong kind of estrogen and they didn't oppose it with progesterone as well.
I did both.
Oh, you did both, okay. Oh, but they paired it with the wrong estrogen. Was it conjugated? Yeah. Oh, so no, that doesn't have the breast cancer. It has a breast cancer risk if it runs in your family. It doesn't. Yeah.
I'm just thinking a lot at some point everyone was
or not. I think the problem is the research just doesn't capture what should be done, and that's what they're working on now. There's a huge call, and women should be happy to know that independently wealthy philanthropic people are now funding women's health research instead of, say, funding the hospital, and maybe it doesn't go to women. They're going right to the researcher and saying, here's $10 million. I want to support your research. It's just about women. So that's happening now, and they're all women philanthropists that are doing that. So the Tree Livings, Poslins, yeah.
The government decides that it's 72. The government decides that it's 72. You don't have to be part of the Ontario breast screens. You can get a breast mammogram. Just go to your doctor and get a referral, And I think in this area, if you're living in Burlington, the best place to go is the hospital. They have the most updated mammogram machine. So don't sit back and just because they say you're 73 or 75 that you can't have cancer, you can. But you've got to take it up to yourself to do it.
Okay, also there's a pilot program at Ghent and Brant where you can walk in and get as many mammograms as you want. Yeah, in that lab there. So if you want 10, go for 10. It's terrible. Okay, go ahead.
I'd like to thank you. Excellent presentation. Is there a possibility that we can get those slides later on? Is Marion going to be able to?
Yes.
Can you make it sure that it's PDF format instead
Yeah.
of PDF?
Okay, I'll send it PDF. Yeah, we need to read. Yeah, otherwise, yeah. Thank you.
One more thing to add, Sandra, is on the barriers to elderly people and you can't social. And I would also add no phone. Some people don't have a
That's
cell
true,
phone.
yes, yeah, thank you for that. So no, not having a phone can lead to isolation for sure. Okay. I have some resources here, if anyone's interested, my business card, information about my clinics, and if you're interested, some books that are helpful reading, you can take a picture and get them yourself. And thanks for coming, everyone. It's great to see you.
Thanks very much, Sue. I've had the opportunity to speak with her several times, and I'm always amazed at the knowledge that she has and the information that you can impart on us. So thanks so very much. So this session is being taped. It will be on the website, posted under the past events section. I'm just racing through this so we get to close off at 3 o'clock. And I will send out a link to the replay, and I apologize if you were here last month and you didn't get the video replay. My month kind of got away from me, so but I promise to get it out again this month. Thanks again to our educational partners. The next session on July the 8th, and Carrie is presenting next month, and that'll be another session you won't want to miss. Please do fill out the evaluation forms. It's important that we get that feedback and your suggestions on services available in the community that you're aware of. And also a reminder, it wouldn't be a birthday party without a treat, so make sure you pick something up on your way out and just to celebrate the day. And once again, thank you so much for being here.